Preventing prosthetic joint infections due to biofilm formation. With the number of joint arthroplasty surgeries rising worldwide, there is an increasing need to focus on preventing infections, not just treatment. This presentation will cover the incidence of prosthetic joint implants and infection, historical methods of prevention and treatment, current technologies under development, a SWOT analysis comparing each method, finishing with our recommended solution for preventing prosthetic joint infections due to biofilm formation. Incidence of prosthetic joint implants and infections. Globally, the number of joint arthroplasty surgeries is rising and providing millions of people each year with long-term pain relief and improved quality of life. According to the Australian Orthopaedic Association, approximately 44,000 shoulder, 600,000 hip, and 700,000 knee replacement surgeries were undertaken in 2018. However, it is estimated that these values will continue to rise over time as more individuals are entering occupations that are sedentary in nature, obesity rates are rising, and countries are experiencing an aging population. According to a study covering 6 national joint registries, the burden of prosthetic joint infections is also rising globally, with infection rates ranging from 0.6 to 1.28%. Although only a minority of artificial joints become infected, it is a significant burden for the individuals as well as for medical industries, costing approximately $35,000 per individual.
Historical approaches to treatment and prevention. Current and historical methods can be categorized into 3 areas: preventative measures, antimicrobial treatments, and surgical treatments. The current primary method of prevention is perioperative antimicrobial prophylaxis. This involves administering antimicrobial agents to the patient prior to surgery, and although this technique has become standard practice, it is not cost-effective and contributes to the increased risk of antibacterial resistance. Once an infection is acquired, many patients are administered with a combination of antimicrobial agents, often to be taken over long periods of time. These antibiotics are required to have activity against surface-adhering, biofilm-producing, and slow-growing microorganisms. Administering 2 antibiotics in combination prevents the development of resistance against one mode of action. However, this process can take up to 6 months, which is timely, and over long periods resistance can be developed for both antibiotics. In some cases, surgical intervention may be required. Debridement involves the removal of foreign materials or damaged tissue in the early stages of infection. However, most cases are not diagnosed until much later. Other surgical treatments involve the permanent removal of the prosthetic implant, and historically, or when infection is too severe, amputation may be necessary. All these techniques are invasive, costly, and involve long and painful recovery times for the patient.
Current technologies under development. An in vivo study found that silver-coated prostheses are highly effective in preventing biofilm formation and halve the rate of infection. This technology works by using cylindrical titanium dioxide nanotubes that are loaded with silver nanoparticles and coated onto the surface of a prosthetic joint. This is then irradiated with UV light and the nanoparticles are released. These particles have been shown to inactivate bacterial enzymes and interfere with metabolic processes through the generation of toxic reactive oxidative species. This technique has been proven to inhibit the growth of common bacteria that cause infection, including methicillin-resistant Staphylococcus aureus and Pseudomonas aeruginosa. Studies also suggest that this antimicrobial activity would last throughout the life cycle of the implant and does not have significant toxicological side effects for humans.
Another method for preventing prosthetic joint infections is to interfere with the process of biofilm formation through disrupting microbial signaling communications. Experts in material science have synthesized peptides that inhibit biofilm formation on titanium and hydroxyapatite surfaces. An experiment showed that exposure to a peptide called DJK5 decreased the biovolume of the biofilm by inhibiting signaling molecules that upregulate adhesion genes used by bacteria for surface attachment and therefore preventing biofilm formation.
Tridipine derivatives, including betulinic acid and uracilic acid, contain biofilm inhibiting properties, making them an alternative candidate to traditional antimicrobial treatments. Extensive studies showed that 22 derivatives carried a diverse range of biofilm inhibitory levels. Another study demonstrated the potency of combining uracilic acid with ciprofloxacin, suggesting that this combination could be extended to prosthetic joint infections in the future.
This technology can be utilized as a local delivery of antimicrobial agents and could pose a solution to the problem of recurrent infections. A protease-degradable hydrogel platform provides a method of in situ delivery of the antimicrobial enzyme lysostefan. This method of prevention has been shown to be more effective than traditional prophylactic techniques, showing an over 99.9% eradication of Staphylococcus and E. coli strains.
All these technologies under development have only been tested in vivo or in vitro and are in the preclinical phase, meaning further studies are required to confirm efficacy in humans before commercialization can commence.
SWOT analysis. Overall, each method has distinct strengths and weaknesses, and the industry poses certain opportunities and threats. However, it is clear from the SWOT analysis that there is a need for methods of prevention that do not rely on antibiotics. An expanding market, investment opportunities, and increasing antimicrobial resistance pose opportunities for developing technologies and biotech businesses. However, threats that need to be managed include lengthy and expensive regulatory approvals and the time delay between now and going to market, as all upcoming technologies are in preclinical stages. Recommendation. As the number of patients requiring total arthroplasty implants continue to increase, the incidence of prosthetic joint infections rise at a proportional rate. The most promising technology discussed involves coating the prosthetic joint implant with silver nanoparticles. This method has been experimentally proven to be effective against methicillin-resistant microorganisms, and the main competitive advantage is that no resistance to this technology has ever been reported. Furthermore, the lack of cytotoxic effects and its long-term efficacy ensures a strong advantage compared to other methods. Ultimately, more clinical trials that reach phase 3 are required before conclusive results about efficacy and safety can be obtained.